Hey, it's Dr. Troy here, Zenaptic Chiropractic. I want to talk about getting the discs of your spine healthier. And one of the tools that we use is this device called the Wobble Chair. And there's two different types here. One has arms on it and the other one doesn't. And the one with arms is going to be used more for a patient who has balance issues, who needs to hold on. But the freestyle one without the arms these are for the elite athletes, if you will, or the elite patients. But they both have the same function. It's just one helps you stabilize more if you've got some issues there. So I always tell patients, be very careful when you sit on these. They wobble, they can knock you off onto the floor, seen it happen. So what we have patients do is we take them through a series of movements. Now, on another video I did, we had a portable wobble chair, which people can take with them, and these are very inexpensive. We have them in our office. These chairs are a little more expensive. They're closer to $400 or $500. We can get them for you. But we have the patient sit on this, and this was designed under a motion x-ray to help get the discs moving, because the discs don't have a blood supply. So any nutrients that come in, any waste that come out, it has to do it through motion and movement. That's why the adjustments are so critical to restore disc function, spinal joint function, and then we correlate that with the wobble chair, and we see great results. So first thing we have patients do is we have them rock front and back. So we have them look down like they're in the fetal position, and then we have them come back up. So they're sticking their gut out, extending their neck back, and then we have them suck their gut in and go all the way down and breathe out. And then we have them breathe in and out. And then we have them do that 20 to 50 times in this plane of motion. And we'll find people who might be in pain and they might have to shorten their range of motion, but the key to any back pain is really to reestablish proper function, proper movement, and we have to take it in baby steps. The next thing we'll have a patient do is we'll have them go side to side. We'll have them drop one hip down, bring the opposite shoulder up, they breathe in and out. So we take them through a series of range of motion exercises on the wobble chair, all designed to reestablish health and nourishment to the spinal joints and the discs, which are so highly publicized on surgeries and different things that many times we can correct these problems through natural manual methods that have been tested over time and time again to work for people. So we have them go side to side, and then one of the last things we do is we have them twist. We have them twist side to side. This is a really good exercise for warming up the lumbar, the low back muscles, for get the cerebral spinal fluid moving. And you know, a lot of people sit all day and they get tight and stiff and fibrotic, and this just helps warm it up. And a lot of patients tell me they feel good. They get a little buzz after they're done doing their wobble chair. So these are things that are included in care in our office. Most patients do this. These are great exercises. We have a bunch of different chairs for people to pick from. And so if you're interested in seeing what we can do to get your spine back on track, consultation's always free. This is Dr. Troy from Zenaptic Chiropractic.